See, there's a tendency to make people believe that dengue spreads only from flower vases that are growing money plants inside homes. That's not true. They claim that it's only happening from coconut shells that may be harboring a little bit of rainwater. That's not true. The vast majority of Aedes mosquito larvae are coming out of stagnant water that's all over the place. You look at any urban drain; they're not flowing.
The rainy season problems you should properly address during summer actually, and summer problems you have to address during rainy season. Now we are what we are trying to do is we are trying to address all these problems when it is raining. So the mosquito breeding sites has to be taken care of.
This is the beginning of the season, and definitely when we are seeing 7,000 as per reporting, those cases are going to increase 100%, and the number has come up because number of OP at government hospitals have come up, number of admissions have come up, so now the number is being counted. But for your kind information, ma, one case of recurrent similar disease in a locality itself, recurring cases in a season should be taken as epidemic. Epidemic definition is more than one case coming up in a season similarly. So epidemic is already started.
Can parents do something to prevent, is there anything at all which you can tell them that, look, these are the things which you can do to kind of at least help in prevention of dengue fever?
Best is to clothe the children fully in dull colored clothes. Clothe them fully. Exposed areas, ideally we are supposed to apply DEP containing insecticide or DEET containing mosquitocide. Okay, but only outdoors, not indoors. Okay, so that's why the best and safest thing is clothe them fully except for hands and face. That's the best method to prevent mosquitoes from biting them. No bright clothing, only dull clothing and loose clothing.
People going in for quick fix alternative medicines. So last 2-3 years, we've been seeing spurt of middle-aged people coming with kidney injury, liver injury, dehydration. That's gone up because they take up some kashayams or something, vomit a lot, come back with dehydration, kidney injury. That's something which we've been seeing for the last 3 years. So we keep telling people, if you have dengue, it's going to be only hydration.
Hello and welcome to South First. I am Chetna Belkere. Year after year, every monsoon, we end up discussing rise in cases of dengue fever. Breeding of mosquitoes doesn't seem to stop. Number of hospitalizations going up every year. Cases reaching its peak in every single state. Political games, political blame games, it's nothing new. Feels like a deja vu for me to discuss the same issue year after year. However, I feel it's very important to do a check to see if there is something that is going wrong, whether there is something which the governments can actually do now to ensure that the number of cases does not increase, and also to understand the newer methods, preventive strategies, changes in clinical scenario in any state. To discuss all these things, today we have with us Dr. Rajiv Jayadevan from Kerala, who is the Chairman for Research Cell of Kerala State Indian Medical Association, member of Public Health Advisory Panel. We welcome you, sir.
Thank you.
We have Dr. Shivaranjani Santosh, renowned pediatrician who has created multiple videos on her YouTube site to spread awareness on dengue. She continues to really fight for dengue prevention and also spread awareness amongst parents on how to prevent dengue cases. So we have other guests as well who will be joining with us later. For viewers who don't know what dengue fever is, it is a mosquito-borne viral infection that spreads from mosquitoes to people. It can be dangerous if not attended to and has symptoms ranging from mild fever to high fever with severe headache, body aches, nausea, and rash. In some cases, there may not be a fever at all. It will get better in 1 or 2 weeks. For some, it can get severe and will need hospital admissions as well. As of now, the dengue scenario in Telangana, there are about 1,000 cases this year. With lack of data, we do not have the exact data with us. And in Karnataka, it is about 7,547 cases. till yesterday, and there have been 7 deaths. In Kerala, it is 8,225 confirmed cases and about 24,000 suspected cases, where 22 confirmed deaths, and we have about 54 suspected deaths. So this is what we have. These are the data which we have from some of the states here. We have Dr. Madhab Karuna, who's also joined us from Telangana. We welcome you, ma'am. It's really wonderful that you could make that.
Yeah, good morning.
So,
Kindly, if you give an opportunity, I'll talk. They are
yes, ma'am, just
expecting
one
principal
second.
secretary.
I'll come to you. I understand you're in a meeting. You have to get back. So I'll first take the question to you itself. We can quickly wrap up on if you can just tell me in 1 or 2 sentences on overall dengue scenario in Telangana. Telangana claims that the number of cases when compared to last year is less. Is that true? And how did this happen?
Actually, definitely the season has started late this time. June, generally we see cases, but this, when I talk to all my colleagues, I see my and admissions and all or have been less. But recently, mild cases have started up. Diagnostic centers work has increased. Admissions are increasing a bit, but not very bad cases as on today. But every year it starts early only. See, my request, the numbers are definitely not to be taken for granted, because people who know the solution towards it. And dengue is a reportable reporting, it should be reported at government center. So that is not being done by each and every doctor. There's a reason numbers may be less.
So you're saying let's not go by the absolute numbers that the health department is giving us, but we should ensure that there is reporting of dengue from each state. Ma'am, do we have 2 minutes to just? I'll go back. I will come back to you in a minute. Dr. Rajiv Jaidevan, could you please let us know what the scenario is like in Kerala?
One more thing, at the end of week, they report to the hospital, the government, or at the end of the month. So the reporting system is also can't be exact number. Okay, thank you.
I agree, ma'am. I agree, ma'am. I'll come back to you. Let's go to Dr. Rajiv. Dr. Rajiv.
Thank you. I agree with Dr. Karuna. What she said is absolutely right. It depends on the reporting of numbers. The other day, Dr. Giridhar Babu had tweeted about this, that you can't blame certain states for having high numbers of whatever it might be, Zika virus, Nipah, COVID, or dengue fever. It all depends on how well the cases are diagnosed, recorded, and reported. So unless the cases are reported, there will be an underestimate. And dengue is a condition that's seen both in the private sector, it's seen in the government sector, seen by alternative medicine practitioners, seen by people who are not medical practitioners. A large number of dengue cases are asymptomatic, so people may not even know they have it. And then there are these people who are having mild symptoms, so which means they don't even go to the doctor. So there are a lot of cases that are happening without our knowledge. So by no means should we think that what we see on television or on spreadsheets are the real numbers. As the doctor said, yes, we must encourage people to report them more and more.
Okay, Dr. Sivaranjani, are you seeing any changes in the the clinical picture of presentation of pediatric dengue cases?
Yeah. So the scenario is, basically the clinical picture is almost the same as it has been the last few years. This year, so far, I haven't encountered very serious, any serious illness in any child. Okay, because a couple of years back, we had a lot of this macrophage activation syndrome kind of picture. But so far this year, yes, in my practice, I haven't seen. But fingers crossed,
Yes.
It's likely to happen.
Okay. Dr. Karuna, do you think that this kind of less number of, like you said, numbers definitely don't really give us a right picture, but I'm just trying to know whether, because Karnataka is seeing a great surge now. Right now in Karnataka, the number of cases is increasing every single day, and the majority of it is in the urban population. So do you see the numbers to go up even more in Karnataka. I'm sure you're following up the case states closely. Also in Telangana, if the number has come down, is there something which you think that the government has done anything at all? Because otherwise, I think OPD wise also you would have seen more number of people coming with severe problems and things like that. So do you see that the government has actually worked towards that?
Actually, definitely the case number will increase. 85% cases are mild, 15% are may require hospitalization, 5% ICU, 1% life risk will be there with complications, as ma'am told. So this is the beginning of the season, and definitely when we are seeing 7,000 as per reporting, those cases are going to increase 100%, and the number has come up because number of OP at government hospitals have come up, number of admissions have come up. So now the number is being counted. But for your kind information, ma, one case of recurrent similar disease in a locality itself, recurring cases in a season should be taken as epidemic. Epidemic definition is more than one case coming up in a season similarly. So epidemic is already started, and 7,000 is a huge number to control the cases. The government is trying centrally. They have entomology team, they have municipal team, they have public health department, they have other health commissioner department. But the ground level of prevention is dengue prevention is at ground level. See, as a citizen, I should remove waterlogging. Many educated people doesn't know to remove waterlogging weekly once in their houses, and colonies should be informed. A day before yesterday, I noted a small breeding site at my house. I had 200 larvae in that, very small amount of water. In spite of talking about it for years, 13 years, I am going to every official. I have noted a breeding larva because I check weekly once. I removed it. Then only I can control the case number in my house. So entomology team, when they go to houses, they don't open the doors also because they think they are from municipal office and they are new people to them. So they don't open. So I suggested to government that you come up with the advertisement, radio, TVs and other places that you citizens, you remove waterlogging in and around your houses weekly once, wear full clothing during this season and use mosquito net measures and all, and inform entomology department of your region. They will connect to you, and 50 houses around your house should be screened for breeding sites. Many of us doesn't know if you compare in educated group also. So what about slums and uneducated people? So they should be decentralized. Number is
Yes.
counted, no? Always the pressure is there from media side and society side on government. But government is not achieved totally because it is not involving public or citizens or doctors. So
Yes, ma'am. I agree with you. I think it's a very
a
important and good suggestion.
lot of stepwise procedures are there towards it, ma'am.
Yes, ma'am. I'll come back to you on this, ma'am. We have Dr. C.N. Manjunath who's joined us. Thank you very much for joining us. I know you have a very busy schedule ahead of you. And then Dr. Manjunath is the former director for Jayadeva Institute of Cardiac Sciences and Research, and he's also the newly elected MP from Bangalore Rural. And he is speaking a lot as a doctor, not just as a politician, but as a doctor on the scenario of dengue in Karnataka. Dr. Manjunath, first, I know you have to leave, so I'll just ask you the question. What do you think should be Karnataka government's immediate move, and what should they start doing? Like Dr. Karuna was talking about, there is a lot of work definitely happening from the government's end on spreading awareness. They're talking about teams, there is a task force, all that is there, yes. But what do you think that it should be done to ensure the implementation of all these things?
Actually, what is happening, the dengue control is mosquito control, basically, right?
Yes.
Dengue control is basically mosquito control. And what is happening, it's not just the question of health department just coming in. See, they have to work in tandem along with the BBMP, they have to work with the Jilla Parishad, they have to work with Bangalore Water Supply Board, Pollution Control Board. So they have to have some proper plan. See what is happening in our state and in maybe in rest of the other places. See, you have to address all these problems. The rainy season problems you should properly address during summer actually. And summer problems you have to address during rainy season. Now we are what we are trying to do is we are trying to address all these problems when it is raining. So the mosquito breeding sites has to be taken care of. And one of the main problem what is happening here is many of these ongoing infrastructural projects, maybe an underpass, maybe flyovers, maybe overbridge, or even the roads, they are all they are not being completed on time within a time bound period. As a result, incomplete I mean all these works is a main source of water stagnation, and particularly when it rains. So this is one of the burning problem. Even garbage disposal is also a big issue. I'm not just talking about only dengue, because all mosquito-borne disease also need to be controlled, whether it is malaria, whether it's chikungunya, or whether it's Zika. So all those things. So certainly, and most important, there has to be a systematic approach. There has to be some sort of a war room also to monitor. I mean, one has to coordinate what is happening, see whether proper mosquito larvicidal spraying is going on. I think this is where one has to properly monitor. Just having meeting and instructing officers doesn't mean anything. See, follow-up is very important. Supervision, monitoring, that is also very, very important. Then coming to the other aspect, see, during COVID, what we did was, because now it is in epidemic proportion. It is in epidemic proportion. So whenever there is an epidemic proportion, we have to actually support the citizen. See, although they have capped the, I mean, they have put a ceiling on the testing price. So in my opinion, I think government should bear the expenses of the testing and also the treatment. Even if they take treatment, even in private hospital, the government should actually take care of the expenses. Take care of the expenses as we did in COVID. Of course, there can be a ceiling limit. I mean, what should be the package rates be? Otherwise, hospitals are also likely to exploit because government hospital alone cannot treat all these cases. So even in private hospital, they have to cap the package rates for treating these dengue cases. That is other thing.
So I have one more question for you, sir. Centrally, do you think anything should be done from the health ministry centrally for dengue management, other than releasing the, things to do and things like that? What is a dengue fever, and there are multiple information that comes in from the central government. But is there something from the Union Health Ministry that should be done?
There can be, of course. They can also, I mean, center can also pitch in. They can also, there are some guidelines, specific guidelines, treatment guidelines, all those things, even preventive guidelines are there. So Union Health Ministry can also interact with the health authorities of the states. I mean, they can do, this is basically to sensitize the whole system. They can always hold a virtual meeting with the health ministries of the states or the health secretaries of the state. So certainly it can do. Another thing going forward, of course, not now. See, now dengue, some of the third world countries also have rolled out the dengue vaccine. So particularly Mexico, Vietnam, and some countries like even in Japan and all. So the vulnerable age group is say between 9 to maybe 8 years to 16 years age group. So there are some trials they have vaccinated. Even if they get dengue, the complications will not be there. Dengue shock syndrome is very rare among the vaccinated people. So I think this is where the state and center should work together, and we have to roll out, because this is going to occur on and on. Next year also is going to happen.
True.
So dengue vaccine is one thing we can always think of vaccinating this thing. And school children, see, school children are getting affected nowadays. Of course, some with dengue, some with other viral infections. So almost every second child is getting infected, running fever, cough, headache. So in my opinion, we have to really involve the school management. There has to be a very strict, instruction should be given to school management. You have to manage this mosquito management properly within your school premises, because many toilets, if you go to schools, they're full of mosquitoes. or many classrooms are full of mosquitoes. So what they should do is every evening they should spray the mosquito. Those disinfectant or whatever it is, anti-mosquito spraying should go on evening, because daytime it can cause some irritation and all. Chetana, another important thing. This is my own observation. See, even if you park your car somewhere and open the windows, mosquitoes will get in, right?
Yes. Right, sir.
So all school buses, all even your BMTC, KSRTC private buses, when they park after their duty hours is over, maybe 9 o'clock in the night, 10 o'clock, wherever they park, either in the depots or in the bus station, that night time they should use this mosquito spraying inside the bus. Then morning, otherwise morning they get in, they open the door, there are already mosquitoes, so they bite. So I think these are some of the ground level thing you should do. And of course, those who are living in slums, as well as in these group houses under Ashraya scheme, where the hygiene is a big issue. In fact, I have suggested to the state government mosquito curtain should be given. I think yesterday they have taken a decision to give mosquito control and all those things. So it boils down to incomplete incomplete this thing, infrastructure, this thing.
Right, sir. Right, sir. Thank you, Dr. Manjunath. Thank you very much for your valuable suggestions. I think some of them are really, really good, and it can be implemented.
Yeah, other thing, just
yes,
last thing. See,
yes,
now a lot of children are getting infected. Not of course, one is on dengue, other viral infections. Maybe for a week, is it worthwhile considering a break, holiday for children from LKG to 7th standard, primary and middle school, just to break this cycle? A lot of children are getting these viral fevers.
Okay. Maybe that is something which Dr. Vijayalakshmi Balakrishnan, who's with us from SIMS Hospital, Chennai. She is infectious diseases consultant. Ma'am, I will just get back to you. Welcome to the show. I will just quickly get to Dr. Rajiv. If you could quickly tell us, taking from where Dr. Manjunath was talking about, vaccination for dengue and things like that. Do you think there has been any new technology or any innovation that is being explored to improve dengue prevention and control?
I think as Dr. Manjunath said, the intervention must start at the grassroots level. And I'm very sorry to say there's plenty of wrong messaging coming even from official sources. See, there's a tendency to make people believe that dengue spreads only from flower vases that are growing money plants inside homes. That's not true. They claim that it's only happening from coconut shells that may be harboring a little bit of rainwater. That's not true. The vast majority of Aedes mosquito larvae are coming out of stagnant water that is all over the place. You look at any urban drain; they're not flowing, and the water is reasonably clear. If it's stagnant, the sediment will drop at the bottom, and any water that is clear and also has organic residue that's from any rotten leaves, stuff like that, is a perfect breeding ground for mosquito. In fact, mosquitoes are known, studies have shown, they zoom in on these areas attracted by the smell of rotting organic matter. You know why they do that? They lay the eggs so that the larvae need food, right? If you put a beaker of sterile water out, they're not going to come and lay their eggs on it. So these drains are a major source of mosquito larvae. Until these drains start flowing, I think blaming the public about money plants and flower vases is not going to do the trick. So there are hundreds of kilometers of blocked drains in every city in India and elsewhere. Studies from Jaffna have shown this. Studies from Indonesia have shown this. These are all published papers I'm quoting, where even from India, there's a study from AFMC Pune that showed clearly that the blocked drains, are the dominant source of Aedes larvae. So I think we should move on from this coconut shell business to actually looking at the larger reservoirs. And you asked about alternative methods. There are other methods introduced, for instance, introduction of some bacteria Wolbachia is a bacteria that was introduced in certain countries in the world. The logic is that if the mosquito is infected by this bacteria, the dengue virus is no longer able to spread, and that's a hypothesis. Australian studies have actually shown that to be true, but if you look at the papers from Kerala, the vast majority of Aedes mosquitoes that are sampled in Kerala are already Wolbachia positive, but we are getting dengue. So you tell me if that's going to work. The other options are fish, certain fish like Gambusia, that can hang around in drains and feed on larvae, but I don't really know if that's like a strategy, because rainwater collects everywhere. It can collect in your rooftop gutter. It can collect on a coconut tree on the side of the leaves, and the mosquito only needs 10 days to come out. So one more problem that has been demonstrated from Kerala is a paper from Trivandrum that showed, it's a very, very interesting paper. They found that if there is dissolved plastic in the water, there are hormonal changes in the mosquito making the cycle faster, which means that instead of 12 days, the mosquito might come out in 11 days or 10 days. And you multiply that over billions of cycles, you can imagine what the outcome can be. There are some other bacteria that are also introduced. So broadly speaking, mosquito control is either larvicidal, which is basically targeting the larva, or the adults, which is basically your fogging and mosquito repellents and so on. So that's the bottom line. A much larger canvas is required, rather than just zoom in on individual properties and blaming people for what they are not doing. The authorities have to wake up and make sure that these drains start flowing first. If the water is flowing, the mosquito eggs will get washed away. That's the point here.
Dr. Vijay Lakshmi, I'll come to you. I wanted to know, there is an overlapping of infections that we see. I mean, this is not a new scenario. I understand that, but then how do we actually, are we seeing that overlap? What is the scenario in Chennai right now, the OPD situation in Chennai when dengue is concerned, or even viral infections per se because of rain?
So we are seeing a spurt of flu-like illnesses, some COVID, flu, adenos. So the slight increase is there. It's been there from last month. And dengue, we just started seeing in Chennai. So till probably 2-3 weeks back, it was quite hot in Chennai. So as rain started coming off late. So from this week, we started seeing an increase in the number of dengues. We are expecting a peak next month. So all of us are getting prepared for that. Again, everybody talked about prevention, treatment aspects. We have two main problems. One is about maintaining hydration, picking them up early. And second problem, which is cropped up quite a bit across India, is people going in for quick fix alternative medicines. So last 2-3 years, we've been seeing spurt of middle-aged people coming with kidney injury, liver injury, dehydration. That's gone up because they take up some kashayams or something, vomit a lot, come back with dehydration, kidney injury. That's something which we've been seeing for the last 3 years. So we keep telling people, if you have dengue, it's going to be only hydration. So nothing else works. So from
papaya
the
leaf? Papaya leaves is a favorite of many. So
papaya leaves, the makeup problem is apparently it's very bitter. And when you they make something like a soup of it, they keep vomiting and come back dehydrated. And there are a few other medicines which are touted. And I don't know which one is nephrotoxic, because we generally, dengue virus per se is not nephrotoxic. So, but last 2 years, we've been seeing patients coming with kidney injury and then recovering. And if you ask them, all of them would have taken something. And we see that from middle age to elder. I see adults, so my patient population. So that is another problem which is cropping up. So when it's dengue, we don't have a magic pill. It is going to be hydration, body will take care. So we used to, as like 5 years back, this florid hypotension shocks actually started coming down in the last decade. But then again, we have started seeing newer complications. Very few of them can develop encephalitis, myocarditis, which some of us see in the apex. But majority will have some capillary leak, which is self-limited. So as long as somebody's hydration is maintained, either by the fluid he takes or with IV fluids, almost 99.9% should not even require transfusions. The problem happens when they come with a bleed or when they come with organ injury. That happens because either you pick them out late or you go for all sorts of alternate treatments and you don't get hydrated properly. And steroid usage, NSAID usage, all of them precipitate shock and bleeding. So as we control that part, It becomes important. So people have to understand, both the patients and doctors have to understand, we don't have magic pills of dengue. It's going to be good hydration and good output.
Dr. Vijayalakshmi, thank you for those inputs. We will quickly move to Dr. Shivaranjani. Dr. Shivaranjani, from the pediatric perspective and also to understand, the vaccination part of it, which Dr. Raji was talking about. What are your views on this?
See, firstly, the vaccine hasn't taken off because if I had already gotten dengue with one strain, and if I take the vaccine and if I get dengue again, I'm bound to get more serious illness. So that's why it has still not taken off. Okay, we still need to do a lot of research into this. Second thing, an effective short video by the government spread all over the country about how to prevent stagnation of water inside the house and outside the house to stop dengue is very, very important, involving celebrities. Okay. The third thing is papaya has no role and government should not endorse. Sometimes they distribute these papaya capsules. So they should never endorse this. It is not useful and it may be harmful, be it gastritis or maybe nephrotoxic, as Dr. Vijaya said. We don't know for sure. Okay. Fourth thing, it's extremely important to understand that hydration is extremely important in dengue, but we are seeing a few macrophage activation syndromes, which will definitely need an immunosuppression kind of treatment, but that has to be under supervision in the ICU. Fifth thing, and the most relevant thing, is that parents have to be educated about the importance of hydration, what to give, what not to give. Hydration means they end up giving sugar and glucose drinks, it's a waste. So they have to know what kind of drinks to give. And also they should be made aware of the warning signs, which tell us that dengue is getting complicated and that they should reach to the doctor. So the warning signs: extreme lethargy, extreme drowsiness, severe pain below the ribs, vomiting, persistent vomiting, bleeding from the nose or bleeding elsewhere, bleeding spots on the body. These are the things which tell us that dengue is getting complicated. So parents need to be made aware of this. I think this is the gist of what I
Ma'am,
wanted.
I wanted to ask you one particular question. When children are going to school, like we know that children are very vulnerable to this situation because schools have definitely breeding spaces. One is for the schools to take responsibility of clearing these breeding spaces. But otherwise, can parents do something to prevent, is there anything at all which you can tell them that, look, these are the things which you can do to kind of at least help in prevention of dengue fever?
Best is to clothe the children fully in dull colored clothes. Clothe them fully. Exposed areas, ideally, we are supposed to apply DEP containing insecticide or DEET containing mosquitocide. Okay, but only outdoors, not indoors. Okay, so that's why the best and safest thing is clothe them fully except for hands and face. That's the best method to prevent mosquitoes from biting them. No bright clothing, only dull clothing and loose clothing.
What about these mosquito patches? And there are recommendations of.
So they are not very effective, and moreover, wearing them indoors all the time, that can worsen your asthma and allergy issues, and long-term side effects also can be there.
Okay.
That's why, see, it's a very tight rope we are walking on, like dengue and allergies. And breathing in these mosquito sites continuously is also not good. So you have to make a fine balance. So best is to clothe them fully. And the schools have to ensure the classrooms are free from mosquitoes. As one of the doctors said, Dr. Manjunath, I think, in the evening after the children have left, let them spray the mosquitocide in the room.
Okay. Ma'am, are there any spaces
But not when
inside
children are there. Not when children are there.
Yes, yes. Are there any spaces inside the school that children should avoid around this season?
So mainly the stagnant water. So the school has to take care of that.
Okay.
So already the experts have spoken about how to prevent larvae from breeding in these stagnant water. So the school has to do it.
Okay. Okay. Yes, ma'am. So coming back to Dr. Rajiv, I wanted to understand, how does climate change has that influenced the increase in dengue cases in India? One, and the other thing is, how does this population movements within and between urban and rural contribute to the increase in the cases, or is it just a disease of urban population? These two things, if you could answer.
Yes, imagine an island that is full of people and no dengue. Now, if that area is full of mosquitoes, let's say Aedes mosquitoes, there will be no dengue because there's no virus in the first place. So, in other words, a mosquito becomes a villain only when there is virus in the population. So, when one person with dengue lands on that island by boat, that person gets bitten by mosquitoes and the entire population can potentially get bitten eventually. So we saw the hub and spoke model. For example, say if you have a school, the child comes to school, sits in a classroom for let's say for 6 hours. If there's one mosquito in that classroom, it can continuously bite other students, and the virus will spread to all these homes. And from all these homes, it will spread to the neighboring homes if there are mosquitoes around. And that's how dengue spreads. And now it has reached countries where it had not been a problem before. For example, in some European nations, there's plenty of dengue at this point. So the other question you asked was about climate change. Yes, if you look at the figures 2022, 23, and 24, over the last 2 years, 23 and 24, particularly this year, there's been an extraordinary rise in dengue cases. You just have to turn on the news to see that the climate's no longer the same, regardless of whether it's India or Switzerland. So clearly, climate change has something to do with this. South American countries, Peru had declared an emergency from dengue several times because enormous numbers of people are coming down with the illness and they're overwhelming the hospital systems. Remember COVID in the first year, something like that. So dengue has to be taken very seriously. But if you I'm a public educator. I talk with the general public all the time. If you ask them, what they say is, see, I get bitten by mosquitoes every day, but I'm not getting dengue. So why are you so bothered? Second is, I heard papaya leaves are good. So I'll just take some papaya leaves and I don't have to take your costly medicines, because if you go to a hospital, you're going to give costly medicines. So that is the way public sees it. And so I think we should change that. Because for the public, it doesn't seem to be a problem for them. So until the public sees it as their own problem, they're not going to take ownership of dengue at all. As was earlier mentioned, it will remain a case of a few health officials making a periodic visit to each home and saying, please invert your coconut shells. And that's a farcical method of approaching dengue. I think mass communication, it has to occur. And as was earlier said, there are 4 serotypes of the dengue virus. For those who tuned in late, there are 4 types of dengue viruses, and they keep alternating. So first, India got dengue serotype 2, and then came 1, and then came serotype 3, and now 4 is dominating. In different areas, there are some individual variations. Now, if somebody had dengue 3 and then got dengue serotype 4, they could get severe disease. And as was mentioned, they could go into multi-organ failure, and some of them can even have a death. But these deaths are few, so the public really did not see it as a problem. So, as I said, we have to let the public know that this is a problem, and if Peru could require an emergency from uncontrolled number of dengue cases, we could have one too. I know of a medical college that had to shut down its departments because of all the staff getting dengue. So that's exactly what I said. If there's one mosquito in an entire office, it can infect everybody. So this is a problem, but it needs a more, let's say, nuanced approach than is going on right now.
Right. Dr. Vijay Lakshmi, COVID doesn't seem to have really taught us any lessons in terms of, preventing it, or actually be prepared for a scenario like this. I mean, we have always gone back to the same war foot method of doing the thing when it actually happens. So and in your clinical scenario, it's always a question which parents, people, everybody come and ask is, how do we identify this when the symptoms start? most of the symptoms are overlapping. Like, I'll come back to you on the same question I'm asking you, because when you get a fever, when you get body ache, you're immediately thinking of COVID now. So then there are multiple people who go for these COVID tests and things like that. So how do we actually differentiate these? Is there any time limit that, okay, you wait for certain time of this, and then this symptom comes down, then you decide that this is dengue, or this could be any other infectious disease? How do you know whether it's a viral fever, dengue fever, or is it unfortunately it's not known? What is the scenario like?
You don't need to. So very simple things for you to follow up. If you have fever, first thing you have to do is make the fluid intake, double your usual fluid intake. Let's say for an adult, we suggest 3 to 4 liters of fluid. Make sure you're passing adequate urine. For take up simple thing like dengue, this alone saves maximum life. So what happens in dengue? There is capillary leak. Water moves out of the blood becomes thicker. So when the blood becomes thicker, there's a chance of low platelets and bleeding. So this can easily be avoided by filling the vessels. So at one point of time, if you're not able to drink fluid, if you're vomiting out, if you have loose stools, your belly pain, that's the alarm sign. So you should not wait overnight. When you're not able to, you have to come back. So whenever people come to us, any kind of fever, first thing we look at is hydration. Take hydration, take paracetamol, wait for a couple of days. If it just persists, then come back. We do basic evaluation. The basic CBC, if it's going to be dengue season, we go for dengue and this one. So it's quite cost effective. That will give us an idea. We hardly see malaria in Chennai. So viral fevers are always there. Upper respiratory tract, now we are not even bothered about COVID. Nobody becomes sick in that. Elderly come with bad flus, but otherwise not much of a problem. So again, supportive care, adequate hydration. If it crosses that, the fever is very high, you're confused, you're not able to retain fluid, something the patient is not able to sit up, walk, any kind of major issues, immediately come to the hospital. That's when we come. What we don't want to happen is coming very late. Bleeding or rash is not something you have to wait for. When your intake of fluid is difficult and if your urine output goes down, that is something which should alert you to go to the hospital. So as you start leaking, there will be some belly pain, difficulty in intake, that will alert you. That should be more than enough to come to the healthcare. Second, with regards to the viral infections, majority are self-limited, 2-3 days. Subsequently, 3 to 4 days, a maximum it takes. Some URI symptoms. If you have increased cough and breathlessness, that's when you should be worried. Or if you have any kind of comorbidities, when I'm talking about comorbidities, especially when there's uncontrolled one, somebody with uncontrolled diabetes, uncontrolled hypertension, cardiac problem, renal disease, liver disease, if you're on immunocompromising medicines, cancer patients, HIV patients, autoimmune disorders, all these people are high-risk population. Them having fever for 48 hours, they should visit the doctor because we have a small window of a lot of medicines. So we should be able to diagnose earlier and follow them up closely. One big advantage of dengue is somehow when there is, you have some pressure inside the vessels and outside the vessels. When you have all these diseases, the capillaries are already the extravascular space is already filled up. So this capillary leak and shock is much lesser in them. So our immunocompromised patients do not generally come with bad florid shock. That's why our mortality is more with younger generation and not with these immunocompromised adults. And that kind of helps us quite a bit. We don't lose transplant patients or patients on immunosuppression much. We just monitor them and follow them up and make sure adequate hydration is met.
Okay, that's interesting. Ma'am, is there anything that they should not do? Like you were talking about papaya leaves and papaya leaf juice, tablets and things like that. Other than that, even in modern medicines which they take, is there something which patients with dengue fever should not do?
No NSAIDs to stop your fever. First of all, fever is, you don't need to make sure your temperature is bang on normal. Child is less than 2 years, you don't want somebody to develop seizures. So you try to keep a target of 101. An adult, you don't require a normal temperature. 100, 101 is fine. So don't go overboard about stopping the fever because what happens initial 2-3 days viral illness, fever will be high. You just have to take paracetamol. Fine. If the fever is still high, fine. Just maintain hydration. What happens at that time when people start getting obsessed with fever, they go for NSAIDs and steroids. And both of them increase the chance of developing capillary leak and complication.
Okay.
So just regular paracetamol, hydration. If you have a gastritic tendency, some gastritic pills is more than enough. If you want some vitamins, you can take it. That's it.
Is there a time that they can is like when you say paracetamol, some people might actually start taking that every 2 hours. So is there a time for that?
Adults we say up to 3 to 4 grams per day is fine. But everybody has to remember, fever just says there is a problem. Fever need not be completely corrected. So a fever of 100, 101 is not, it just says that you have a problem. Doesn't mean that you have to bring it down to 98.3 or 99. So that's something people have to remember. So 1 gram 3 times a day of QID is more than enough for adults.
Okay. Thank you very much, ma'am. Thank you very much for your time. Dr. Rajiv, is there anything quickly you want to sum up this with?
I'm glad you took up this topic and took in multiple insights from experts. So we need to continue with our messaging. It has to reach not only grassroots, but also the policymakers to make more effective strategies. Thank you.
Thank you very much. Thank you all of you for participation. Thank you very much. That's all we have for today.